Hey, this is Dr. Garrett Harper at Harper Cosmetic Surgery. We're going to talk a little bit about breast implants. First and foremost, I want the patients to know that you actually steer this ship. This is not my decision, it's not your friend's decision, it's not your loved one's decision. And so what I want most of my patients to do is come in here with an idea of what their wish picks would be. I constantly tell my patients to find me pictures that will demonstrate, they say a picture is worth 1,000 words, and that's really going to ideally be able to communicate to us as visual learners what you want as your result. So wish picks are very, very important. The other component to breast implant surgery is I'm a biodimensional breast surgeon, meaning we're going to take a lot of measurements and we are going to adhere and use those measurements to choose the right implant for you. There's plenty of patients who come in here with preconceived notions because their friend or their family members had an implant, or they look online at before and afters and they read underneath and they say, this is the implant I want. And what you have to realize is that your body's different, your starting point's different. So what we want to make sure is that we choose the right implant for you. And so for patients, we're going to take a series of measurements and then we're going to use those as our guidelines to choose the right implant. There's over 200 different implants, and by taking simple measurements and listening to you, we can narrow those down to about 5 to 10. Your wish picks are going to be what narrows those 5 to 10 down to the perfect implant for you. What's wonderful is that we've got brand new implants that have been available for the last couple of years that are called this gummy bear implant. These are wonderful, they feel great. We've got them here for you to grab a hold of, throw up against the wall, do whatever you want to with them. They're practically indestructible, and the idea of this rupture and this gel leak, it just doesn't exist anymore. So they have been tirelessly researched and studied, and they're completely safe. And please know that we would never use anything that we didn't feel entirely confident in. These implants have also made it much easier for a recovery because these implants do really well above the muscle. 20 years ago, when only saline implants were allowed to be used, those had to go underneath your muscle. And it kind of started this whole big trend where implants were all placed in that plane, even after gels came back onto the market. What the newer implants are able to do is maintain their shape in different posture changes, and so you don't need that muscle to be raised and elevated up anymore to cover the upper portion of the implant. So they're safe, they can be placed above the muscle, which is an easier recovery for most patients. And we use small, less than 2-inch incisions that are in your inframammary fold. We don't place implants through the nipple-areolar complex, we don't place them through the armpit, we don't place them through the belly button. This allows us to have the safest, the cleanest, the best way to place these implants into the pocket so that you can have the longest lasting and best result. I'll also say that, implants come in a myriad of different profiles, and so your wish picks are going to help really us narrow down exactly how much va-va-voomp you want to your breasts or how conservative you want them. The good thing is that there's so many different options for women these days. What we've got to do is help you narrow down your options so that we can get the best result possible. Afterwards, it's going to take some time for your tissues to be able to accommodate the new implant. We say at first, you may look very kind of operated on or fembodish if you've ever watched Austin Powers. However, things will settle, things will stretch, things will look more natural as time goes on. It's a different timeline for everybody. It's not always 2 weeks, it's not always 6 weeks. And so really, the timeline's gonna be however long it takes for you to get that kind of final settle. We're gonna have you wear a supportive bra while you're healing. We're gonna have you take care of your incisions with tape and scar gel, which is gonna get you the flattest, prettiest scar possible. And then once we're a few weeks out and you're kind of up and running and back to normal activity levels, I'm gonna have you do some kind of daily movements of your implants. Gonna try to have you get them to touch. Up and in, down and out is not the direction any woman ever wants her breasts. So I typically say there's no prescription for this, but every time you brush your teeth, if that's morning, noon, and night, or morning at night, just take about 30 seconds and move your implants and try and get them to kind of give you some good pronounced cleavage. That will maintain the pocket size and will leave everything in a more natural and a softer feel. So that is the nuts and bolts on breast implants. Thanks.